Hello everyone, welcome to my channel. Pharmacology is my passion. First of all, I would like to thank each and everyone for showing their support to my channel. Thank you so much. It really means a lot to me. Okay, let's start with the topic pharmacotherapeutics. Pharmacotherapeutics. So what the pharmacotherapeutics means? Pharmacotherapeutics simply means first of all, the pharmacotherapeutics is the branch of pharmacology. It is a branch of pharmacology. Okay, so it is a branch of pharmacology. Okay, and what it does, it provide the knowledge and the skill which is necessary for the quality use of medicine. Okay, so it provides the knowledge and the skill which is necessary for the quality use of medicine. So here the first topic, see, the pharmacotherapeutics is the use of a drug to treat the disease. So in pharmacotherapeutics, what we will study? We will study how to use the drugs to treat the particular disease. Okay, next point, when choosing a drug to treat a particular condition, healthcare providers consider not only the drug effectiveness. Okay, so they not only consider the drug effectiveness but also other factors such as the type of therapy the patient will receive. Okay, so what they will consider? They will consider the type of therapy. They will consider the type of therapy the patient will receive. Okay. Okay, so simply pharmacotherapeutics, first point is a branch of pharmacology. Second point, it provides the knowledge and the skill for the necessary. It provides the knowledge and the skill which is necessary for the quality use of medicine. And the another point, pharmacotherapeutics is the use of a drug to treat the disease, to treat the particular condition. So what is happening in this? When choosing a drug to treat a particular condition, healthcare providers, they will consider not only the drug effectiveness, okay, but also other factors such as type of therapy the patient will receive, like which type of therapy the patient is going to receive. So they will consider that factor also. Okay, so now we will see here, not all therapy is the same. As we all know, yes, not all therapy is the same. Okay, so here, okay, so what is happening? The type of therapy a patient receives depend on the severity, okay, urgency and prognosis of the patient condition and can include these all. Okay, for example, here we can see acute therapy, empiric therapy, maintenance therapy. So what is the acute therapy? Okay, what is the acute therapy? If the patient is critically ill and require the acute intensive therapy, so that comes under the acute therapy. So that kind, if the patient is critically ill and require the acute therapy, so that kind of patient is provided acute therapy. Empiric therapy, based on the practical experience rather than on pure scientific data. Okay. The another is the maintenance therapy for the patient with a chronic condition that don't resolve. So in such kind of patient, what the therapy is given? It will be maintenance therapy. Okay, now moving towards the supplements or replacement therapy to replenish or substitute for missing substance in the body. So this kind of therapy is called as replacement or supplemental therapy. If something is lacking in the body, so for that kind of patient, that kind of patient is provided by replacement or supplemental therapy. Supportive therapy, which does not treat the cause of the disease but maintain other threatened body system. Okay, so what is happening in a supportive therapy? It does not it will not treat the cause of the disease, but it will but maintain other threatened body systems until the patient condition resolve. Okay, and the last one is palliative therapy, used for the end stage or terminal disease to make the patient as comfortable as possible. Okay, so now we are moving towards a very important point. I'll tell you what. Okay, we are moving towards the very important point, that is, I can only be myself. So why it's mentioned like this here? Because I can only be myself. So what does it mean here? Every body is different, even physiologically as well as psychologically. Okay, so I'll explain this. A patient overall health as well as other individual factors can alter that patient response to the drug. Coinciding the medical conditions and personal lifestyle characteristic must be considered when selecting drug therapy. So simply it's saying its simple meaning of this is everybody is different. Everybody is different, even physiologically as well as psychologically. So here we will see how. Okay, here we will see how. Okay, so factor affecting a patient's response to a drug, it's very important thing. Okay, because no two people are alike physiologically, which I was mentioning, which I was explaining, or psychologically. A patient response to a drug can vary greatly depending upon such factors such as age, cardiovascular function, diet, disease, drug interaction, gender, depend upon the patient is a male, female, GI function, gastrointestinal function, hepatic function, infections, and renal function. So these all factors are very much important. Okay, these all factors are very much important for the response of a particular drug. Okay, so decreased response. So here it's showing decreased response. So what does it means? In addition, it's important to remember that certain drugs have a tendency to create a drug tolerance and drug dependence in patients. So, what is the drug tolerance? Drug tolerance occurs when a patient develops a decreased response to a drug over time. So, what happens in this? If a particular patient is given by a particular drug for a longer period of time, so after certain period of time, the patient body stop responding towards that drug. So in that condition is called as drug tolerance. Okay, and the patient then require the larger dose to produce the same response. So at the same, like if as I was mentioning, the patient is given by a particular drug for a longer period of a time. So after certain period of a time, the patient will not show that response which the patient was showing before. So in that condition is called as drug tolerance. So how to overcome that condition? So to overcome that condition, the patient has to be given by a larger dose of the same drug to produce the same response. So that's called the drug tolerance. That is the drug tolerance. Okay, and it's very important to understand. Okay, and increased desire. Okay, so what it means, I'll explain. Tolerance differ from a drug dependence in which a patient display a physical or psychological need for the drug. Physical dependence produces the withdrawal symptoms when the drug is stopped, whereas psychological dependence is based on the desire to continue taking the drug to relieve the tension, avoid the discomfort. Okay, so increased desire means what happens if the particular patient is taking some particular medicine for a longer period of a time. So after some time, what happen, it will cause the drug dependence, and patient will get dependent on that drug physically as well as psychologically, because even the patient is feeling better, but he will psychologically depend upon that drug because it became its habit. So it's called as drug dependence. It can be of physical dependence of a drug or psychological dependence of a drug. So in physical dependence produces the withdrawal symptoms when the drug is stopped. So sometime what happen if suddenly one patient is taking some medicine for a longer period of a time, but suddenly that drug is stopped. So what will happen? It will show some side effects, or it will show some, that's called as the terminology for that is withdrawal symptoms. It will produce the withdrawal symptoms when the drug is stopped. Whereas psychological dependence is based on a desire to continue, like it's a patient desire to continue that drug which the patient was taking for a longer period of a time. So just to relieve the tension and avoid the discomfort. So that is called as drug dependence. If you have any question, anyone, please ask me in a comment box. I'll answer as earliest. And till here, we'll finish the pharmacotherapeutics in a very short and in a very easy way. So it will make you all understand all the points easily. Okay. From the next, in my next video, I'll teach you about the drug interaction. It will be our next topic. Okay. So thanks for watching my channel, and please keep supporting me. Please like, subscribe and share my channel. Thank you very much. Thanks. Please like, share, subscribe my channel, and if you have any question, please ask me in a comment box. Please subscribe my channel.